Thank you, Rhonda, and good morning, everyone. I would like to begin with a question. Which province in this country has the second worst RN to population ratio? And I say the second worst RN to population ratio. If you guessed Ontario, you are correct. In fact, according to the latest statistics from the Canadian Institute for Health Information, Ontario has 70.8 registered nurses per 10,000 population, down from 72.1 in 2010, while the national average is 83.4, up from 82.9 RNs per 10,000 populations. Yes, you heard right. While Canada's RN to population ratio has improved, Ontario's has declined. This inevitably affects nurses' workloads and patient outcomes. In fact, in the past 2 years alone, we have lost over 1,000 RNs positions in the workforce. This should trigger the alarm bells for the government and the public. But the government so far has shrugged it off. This makes no sense, especially at a time when our population is growing, becoming older, and their health needs are increasing and becoming more complex. So we have to reverse this trend, and we must do it fast. People's lives are at stake. In order to catch up with the average RN to population ratios in Canada, Ontario needs to add to its workforce almost 17,000 registered nurses. RNAO is asking for a smaller number. We are asking that government act on good policy and goodwill by adding at least 9,000, not the 17,000 that actually we need, but 9,000 full-time RNs by 2015 to begin closing the gap. Not all is bleak with the nursing workforce. There is some good news. More nurses in Ontario are working full-time, providing continuity of care and caregiver to patients. RNAO has long advocated for 70% of all nurses to be working full-time. Patients deserve nothing less, and the evidence shows that when you have a higher proportion of full-time registered nurses on staff, you have lower rates of complication and better patient outcomes. Our health system prides itself on professionals who collaborate each and every day to take care of patients. Equally important is the need for all health professionals to be able to work to their full scope of practice, meaning to their full capacity of competencies, knowledge, and skills. RNs are no exception. And in Ontario, we could do a lot more to make this a reality. Working to full scope means giving RNs the opportunity to do what they can do based on their knowledge and skills. Our system is evolving. And when you couple that with complex care needs of Ontarians, you also need RNs who can take on expanded roles. This will result in faster access to quality care for the people of Ontario. Currently, RNs in Ontario are limited compared to what they can do in other jurisdictions across Canada and abroad. For example, RNs in the United Kingdom can prescribe lab tests and medications for the past 15 years. Yes, you heard correctly, for the past 15 years. Provinces across Canada, including BC, Alberta, Saskatchewan, and Manitoba, are already moving in this direction. Where is Ontario? I ask you and I ask the government. In a report we released last June called Primary Solutions for Primary Care, Maximizing and Expanding the Role of the Primary Care Nurse in Ontario, we pointed out that efforts to both maximize and expand the role of RNs who work in primary care must be taken urgently in Ontario to improve our health care system efficiency and become more cost-effective. And speaking of taxpayers' dollars, there is another way we can improve our system. We can save money and make it more responsive by decreasing duplication and improving integration. In fact, I heard the minister speaking about this just during the elections of the leader for the Liberal Party. She spoke about improving integration and decreasing duplication. Well, the minister is aware that the report was released by RNAO this past October, called Enhancing Community Care for Ontarios, or how the sector calls it, ECHO. It proposes a 3-year plan that anchors the system in primary care. That will start to move us, as Rhonda suggested, from an illness model to a health model. It urges the government to ensure every person in the province has timely access to comprehensive primary care, with a greater emphasis on health promotion, disease prevention, chronic disease prevention and management, and mental health. ECHO recommends that local health integration networks lead health system planning for all sectors, and to make sure the voices of patients are present at the planning table through patient-family councils at each lean. Again, that will bring us closer to what my president said of moving from a focus on professionals to a focus on patients. Another facet of ECHO model would see the functions of community care access centers integrated into existing areas of the health system. This means, as a first step and immediately, transitioning the 3,500 case managers and care coordinators from CCACs into primary care through a carefully crafted labor strategy that ensures no loss of compensation. These expert case managers would be anchored in primary care, serving Ontarians with complex needs and multiple comorbidities. You may be asking, is it not the health links of the minister? I would be happy to respond the differences of the two when we come to questions. RNAO says that at the end of the ECHO 3-year plan, CCACs would be eliminated. Yes, you heard correctly. 3 years from now, CCACs would be eliminated. And LINs would take on the entire planning for the healthcare system. After all, if LINs cannot deliver on this after 10 years of existence, because right now they're 7 years, they will be by then 10 years, it begs the question of what are they here for? Making primary care central to Ontarians means also affording them the benefit of care by interprofessional primary care teams, which RNAO has been asking for many years, and now we are putting a generous timeline. All Ontarians access to interprofessional primary care teams by 2020. That's plenty of time. This can be accomplished by expanding existing interprofessional care practice models that hold infrastructure capacity and by creating new sites where no capacity exists. To achieve this, the government needs to invest more money in community health centers, nurse practitioner-led clinics, Aboriginal health access centers, and family health teams. And it means limiting and no new funding for new solo physician practices. I want to talk about the success of Ontario's 26 nurse practitioner-led clinics, which this government had the privilege to move forward. Built from the ground up, they are a highly successful interprofessional model of primary care delivery that has improved access for thousands of people across the province. They are led by nurse practitioners who work alongside registered nurses, registered practical nurses, social workers, pharmacists, physicians, dietitians, and others according to people's needs. These clinics offer comprehensive primary care and help people navigate the health system. They are cost-effective and responsive to the needs of their clients. In fact, they are so successful, we want to see existing ones funded so that they can operate to full capacity, and new ones open in areas where there is a patient need. Let me give you one example. The Lakehead Nurse Practitioner-led clinic in Thunder Bay is just one, where clients are currently on a wait list to get in because the targets were met. 2 fully equipped exam rooms are ready to go, and yet the government is not providing the funding, operational funding, which we are talking is about $180,000 a year. So we put it in perspective to open those 2 exam rooms and have the patients being seen by the clinic rather than in wait lists going to emergency departments. What this clinic needs, it's government funding to add 2 more nurse practitioners to the mix. And yes, we have here also one of our board members who actually also runs, Tammy is there, who also runs one of the nurse practitioner-led clinics in Ontario. One of the most important things we can do in nursing is also to level the playing field when it comes to wages. It is no secret that a nurse who works in a hospital earns more than a nurse who works in long-term care or in primary care or in home health care. But their work is not less important, especially not if we want to move from an illness model to a wellness model, especially not if we want to be patient-centered and take care of people closer to their homes or in their homes. Wage differentials essentially act as a disincentive and mean many nurses who could or would want to be working in home care or long-term care are choosing to work in hospitals simply because of better wages. Our recommendations to improve nursing care are: hire 9,000 additional full-time registered nurses by 2015. And let me be very clear, we are speaking about registered nurses, RNs, not about registered practical nurses, RPNs, which have increased significantly the numbers in Ontario, when the research shows that the number of RNs has a direct impact on patient outcomes, when Canada has 83 and change RN per population, and instead Ontario is going down and down and down, and we are now the second worst of the country. Ensure 70% of all nurses work full-time so patients have continuity in their care and caregiver. And yes, kudos to government. It was Premier McGuinty that in 2003 took on this policy platform on the 70% and has made huge progress. Third, secure fair wages for registered nurses and nurse practitioners working in all sectors of healthcare. Maximize and expand the role of RNs to deliver a broader range of care, such as ordering lab tests and prescribing medications. Manitoba, Saskatchewan, Alberta are already moving. So should we. UK has been doing this for the last 15 years. Why not Ontario? Ensure all existing nurse practitioner-led clinics are funded to operate to full capacity, and opening new nurse practitioner-led clinics, community health centers, and family health teams where patient need exists and infrastructure is not available. Improve navigation across our complex system by partnering with patients to coordinate their care through primary care in community health centers, nurse practitioner-led clinics, and family health teams. That is accomplished by transitioning the case managers and care coordinators from CCICs to be anchored and working out of primary care. Commit to providing all Ontarians with access to interprofessional primary care and not solo physician practice by 2020. Support leans to achieve regional health system planning, integration, and accountability for all health services, using an evidence-based and person-centered approach rooted within a population health primary healthcare framework. Eliminate community care access centers by 2015, and as I said before, transition, starting now, the case managers to primary care. I want to shift now to an area of our health system that is under attack. Last fall, RNAO spoke out against the proposed sale of the Shouldice Hospital to a company controlled by a U.S. conglomerate. We spoke out for several reasons. In recent years, the federal government has taken a hands-off approach to the principles and the spirit of the Canada Health Act. It turns a blunt eye to jurisdictions that experiment with two-tier services, delisting, user fees, income means-based testing, and private for-profit medicine. We also know that the federal health transfers will eventually be pegged to a province GDP, meaning far less money will be provided to provinces and territories than in the past. Roy Romano, a previous Premier of Saskatchewan, has described Ottawa's plan for healthcare transfers as a deliberate strategy to abandon healthcare to the provinces and foster the development of more private for-profit medical enterprises. It is truly amazing because all the research tells us that publicly funded, not-for-profit healthcare delivers better health outcomes at a lower cost. All we have to do is look south of the border for the evidence that commercialization of healthcare has not served Americans well. I'm happy to report that the company that was interested in buying this Shouldice clinic decided against the sale. But we cannot rest. We need to be vigilant because there are for-profit interests that will stop at nothing to make money of our cherished system. And yes, nurses were involved in influencing this decision. In fact, over 2,000 nurses wrote letters to the Premier and to the Minister, urging them, demanding from them that they stop the sale of that clinic, which needed to be approved by the Minister to take place. This does not mean that there isn't room for improvement or innovation. RNAO has had the privilege of being part of a working group together with the Canadian Medical Association and the Canadian Nurses Association. RNAO's evidence-based clinical practice guidelines on wound care has been accepted by the working group on innovation in clinical guidelines led by Premier Brad Wall and Robert Gitz. These are the kinds of improvements we should be making to strengthen our publicly funded system. These are the type of improvements registered nurses are offering in our policy platform to all political parties. Our recommendations for Medicare are: commit to and expand our publicly funded, not-for-profit healthcare system in areas such as home care. Reject efforts to commercialize or privatize health service delivery, and focus on well-researched and demonstrated policies and evidence-based clinical practices to optimize the health of people, families, communities, and our health system as a whole. Finally, nurses are well aware that Ontario's economy is still recovering from the recession, and that we are affected by global events we can't control. But the austerity agenda has not served well Europe. The austerity agenda will not serve, cannot serve well Ontario. We need to put our deficit and debt in perspective. It's also important to understand that spending cuts for social programs would only punish the economy even more, not help it. We have witnessed on the news the effects of the austerity policies in Europe and also in parts of the US. Yes, our deficit is significant, but it's also manageable. Our recommendations on how to pay for our agenda is: make sure people pay their fair share of taxes. Tax cuts for wealthy people and cutting spending for social programs not only hurts people, it hurts the economy. Impose green taxes to help pay for the damage polluters cause. Before we open to questions, I want to take a minute to thank a person that for the past 10 years I have been working closely, and that is Premier McGuinty. But I also have a message for Premier Designate Kathleen Wynne. The reality is that Premier McGuinty advanced a very progressive policy agenda in the first and second term, not on the third. If you look at the declines in nursing that I was mentioning to you, they happen in the last 2 years. If you look at some other aspects of social programs like minimum wage, it's also in the last 2 years. So the message for Premier Designate, and congratulations, Kathleen Wynne, and to the leaders of the opposition parties is be thoughtful. Be thoughtful and be determined to take Ontario into the right path, because to go wrong may mean we will end up like Europe. Thank you very much, and we will open for questions.
Thank you very much.